we go. Hey, everybody. Thank you for joining us. I'm real excited to have Jenny Spencer with us today. And on the screen here, you guys should be able to see her Facebook page. She's on a mission to provide a safe and effective and individualized fitness service to those with cancer in order to improve physical, mental, and emotional health and well-being throughout the cancer care continuum. So she's going to talk with us today about some of those things, and we're excited to have her. And Jenny, could you tell us a little bit about yourself?
Yeah, thank you all so much for having me. My name is Jenny. I am from the Chicagoland area originally, and I have been an oncology nurse for the entirety of my nursing career. So that's been 10 years. I graduated in 2010, and I have witnessed, I have not had to deal with cancer myself, but I have witnessed the disabling effects that the treatments that we give, how they can affect your quality of life, which has really led me to exercise oncology and starting up Fight the Fatigue so that we can use exercise as a way to help improve your outcomes. And it's something that you're capable of doing, and you have the ability to change your outcomes through exercise. So I am very excited to dive a little deeper into what exactly exercise is and what you need to look out for if you're living with cancer and how it can benefit you.
Awesome. So I'm going to give you the ability to share your screen. And give me 1 second here. You should see a green button on your screen, Jenny, that gives you the ability to share.
Yes.
Go ahead and try that. And then it'll ask you to choose your PowerPoint presentation. There you go. Awesome.
Can you see it okay?
Yes, we can. It looks like we lost your video, though.
Oh, it might be because I made this full screen. Hold on.
Nope, still not seeing your video.
Okay. You know what? I think when I share my screen, it automatically stops my video. Can you see me now?
I can see you now. Yep.
Okay, perfect. And you can still see my screen?
Yes, we can.
All right, and you can see that? We're
good to go.
Perfect. So again, thank you all for having me today, and thank you for joining. This is something that is very important to learn about so that you know how it can help better your outcomes while you're going through the cancer care continuum, and really try to capitalize on how much exercise can help affect your quality of life. So I thank you for joining us today and really investing in yourself by coming to this presentation. I did a little bit of a background just a couple minutes ago, but my personal training operation is called Fight the Fatigue, and its main mission is to provide safe, effective, and individualized fitness services to those living with cancer in order to improve their physical, mental, and emotional health and well-being throughout the entire cancer care continuum. So this is from start of diagnosis and into the late survivorship phase. I am a certified oncology nurse. I have worked in a lot of different areas within oncology, the inpatient setting where you're hospitalized and you're getting treatments or coming and going from radiation, to the outpatient setting in the infusion center where I've actually been giving or administering the cancer treatments such as chemotherapy or immunotherapy, as well as the clinic side where you manage more of the oral chemotherapy agents. So I've had a background in multiple different cancer treatments, and the main side effect that I noticed throughout whatever treatment was being administered, and even with radiation effects, as well as whichever cancer subtype population I was working with, that cancer-related fatigue seemed to be a very big and consistent factor and side effect in the patient's care. And the fatigue that they would feel would influence their quality of life, and it would also influence their physical functioning. We know that cancer treatments can decondition us, so that fatigue and the deconditioning can really impact your quality of life. And right now, exercise seems to be the main intervention that can help those the best, and we'll get more into that. So this is where Fight the Fatigue came about, to see if we can, or see if I can influence the cancer care continuum by working with you in home-based personal training services, now virtual as well, amidst COVID, so that I can meet you where you are and take into consideration your diagnosis and treatment. And this is my contact information. Feel free to reach out to me if you have any questions at the end of this session. So I always like to start with what exactly is physical fitness. I think a lot of times we get confused with what physical activity is versus what being physically fit is versus what exercise is. So these first couple of slides are going to go over the differences so that you can understand more why exercise is an important component of your care. So physical fitness itself has four different categories. We like to say that there's 5, but this last one that we'll talk about. So the first one, to be physically fit, there's these components. Muscular fitness, that includes your muscular strength and your muscular endurance. Then there's your cardiovascular endurance, which is also known as aerobic fitness. And this is the ability of your body to uptake oxygen from your surroundings and use it as fuel or energy within your body, okay? 3 is flexibility, and 4 is your body composition. This is specifically important in the kidney cancer population because there is strong evidence to connect being overweight or obese to kidney cancer, so that's a big risk factor. There's 2 components to body composition. One is lean body mass tissue, and that's basically your muscles, your organs, everything that's needed in your functioning. And then there's your body fat or your adipose tissue. And this is, the role of your adipose tissue is to store energy for later use. Your lean body mass tissue actually has been shown to have a higher metabolic rate. So therefore, because of that, it's more beneficial to your physical performance. So it helps with your endurance and your strength when you have lean body mass. And then the 5th component to physical fitness, I would argue that this should be included as well as a lot of other fitness professionals, is your mind-body vitality. And this can be more, a lot of people like to think of yoga with this, but yoga, meditation, mindfulness, so you're connecting your mind to your body. A lot of breathing exercises also influence this connection. Okay, and then, so we know what it means, what are components to be physically fit. Now, what is physical activity? Physical activity is you're doing it all day. So it's the utilization of energy to perform a movement in order to complete a task. And with you doing physical activity, you are engaging your muscles. So you're contracting and lengthening your muscles throughout the day so you can move. And you're also using your cardio endurance to get tasks done. So doing physical activity can be influenced by your physical fitness components. Okay. So physical fitness components influence your ability to complete a physical activity. There are 5 functional movements. Some would argue there are more, but there's 5 basic functional movements that you do consistently throughout the day so that you're able to take care of yourself or complete activities of daily living, or your ADLs is what your healthcare team may refer to them as. 1 is the bend and lift movement. So that's essentially a squat, bending down and lifting up. Another one is a single leg movement. And this is when you're transferring weight to your other leg. So this is when you're walking, when you're running, when you're bicycling, when you're going upstairs. You do this a lot. A pushing movement, so that's you pushing open a door or closing a door, things like that. And then there's a pull movement. This can be lifting up a child from the ground or lifting up groceries. And a rotational movement, and this is you moving from side to side, right in this middle area. A lot of times we do this when we're maybe in the car and we're going to get something from the back seat and we're turning. When you're putting on your seatbelt, you're doing a rotational movement. Throughout the day, you're doing these movements in conjunction with one another, or consecutively, but usually there's a couple of these movements that you're doing to complete a specific task, like picking up your child and putting them in the car seat, or going grocery shopping and pushing the cart, reaching for items, and doing multiple different movements. Physical activity can also just be, leisurely bike riding and things like that with your family. So things that you are doing that you enjoy. Now, what is exercise? Exercise is a more structured form of physical activity with specific goals in mind. So we know what physical fitness is. We know the components, those 5 components. They influence how we can do physical activity throughout the day and take care of ourselves. Now, exercise is more structured so that it can put a good stress on your body in order for it to get stronger, adjust, and improve. So by us working on those physical fitness components on that first slide, your muscular strength, endurance, aerobic fitness, flexibility, and your body composition, as well as your mind-body vitality. That's a well-rounded exercise program, and that's going to help you do your physical activities throughout the day in a safer way and more efficiently, not just time-wise with you completing the task, but also body-wise and body mechanics. We want to make sure we're doing the right movements so that we're not putting any added stress on parts that should not be having added stress if our muscles were stronger. There are certain principles to exercise, and these are very important to consider when you're starting an exercise program, because a lot of times you can maybe move too quickly, too soon, and you can get discouraged, or you might do it for a couple weeks and then kind of trail off and not do anything and then try to come back right where you were. So one of the principles of exercise is specificity. I can never say that word, so I'm very sorry. I like to think of it as putting all your eggs in one basket. So say you love running and you run all the time and you don't do any type of resistance training or stretching or anything like that. So you're just really working on your aerobic fitness. If that's the case, you are only going to strengthen your aerobic fitness. So if you're a runner and you're not doing resistance training or flexibility training, then you're really not going to improve certain muscular strength and endurance because you're not working it. Progressive overload is the second, and this is where you need to be careful when you're starting an exercise program, because you need to be mindful about how quickly you're going. So you need to challenge yourself to grow, is how I like to think of this, but within reason. If you are not continually challenging your muscles or your cardio strength or flexibility, then it's not going to continue to get stronger so that it could be more efficient for you to complete your physical or your activities of daily living. So you need to challenge yourself to grow, but within reason. If you are moving too quickly in an exercise program, you are going to tire yourself out, especially when you're going through the cancer care continuum. And then you're going to get discouraged and not want to continue, or you may get discouraged, try to go back where you were before, and you're not going to be there because you haven't been continuously challenging yourself or progressively working those muscles so that you can make an impact. The third one is diminishing returns, and this is working up to your full potential. So we all, have our genetic potential, they like to call it. So if you train for a marathon and you just, you can't get any really better than the time that you keep trying to beat, then you may have just worked up to your full potential. That doesn't mean that you should stop exercising. It just means that there's certain genetic potentials to specific people. Specifically to the cancer population, what they have found is, within all the exercise studies that have been done, is that there's the most potential for those that are less physically fit to improve. So this is important to remember. 4 is reversibility. So if you don't use it, you lose it. If you do an exercise program for a couple weeks and you're making great progress and you're feeling stronger, and then something hits and you are feeling really tired from treatment, or you're on vacation or something like that, and you don't work out for a month, then all that gain that you made those couple of weeks is going to revert back to when you first started getting active again. So that month later, with that break, you'll have to start kind of from square one again, because you have to train those muscles to progressively overload and get stronger to get back to that point you were before you kind of dropped off on your program. We all have one body that we were given to live in, so it's very important to take care of ourselves, and this is where exercise can really help you. I always have a lot of patients asking me, what can I do to help improve my outcomes? And exercise, or being physically active, or taking those measures to be more physically active during your day, is going to help you. So it's important to remember that our body is a gift and we have to treat it as such, and definitely take care of ourselves. Exercise, I like to put these in here because I feel like a lot of people believe that exercise has to be a very strenuous program that you go through, as if you're training for a triathlon or a marathon, or you're a weightlifting champion, and it does not. It can be something not as intense, but the intensity level is based on you, the individual. So each program should meet you where you are so that you can progress. You are your own competition, and you should not compare yourself to anybody else that is active. You are where you are, and you are improving based on what you're doing. And it can be a lot of fun to be physically active and exercise, especially if you do it with your family. So now bringing in the cancer part of it with being physically active. Cancer sucks. Excuse my language if you don't like that word, but it sucks in every color, no matter what you're diagnosed with. It is an unwanted visitor that has entered your life and your body, and it is undeserving in so many ways. So I just want to acknowledge here that cancer sucks, and nobody should have to go through the disabling effects that cancer diagnosis and treatment can have. So acknowledge that, and now let's move forward and think about how can we continue to improve despite having a cancer diagnosis. Cancer does not define you, and it should not. So cancer exercise. Is it safe and is it effective? It is both. So it is safe and it is effective. Back years ago, even when I first started oncology 10 years ago, it was very uncommon to recommend that our patients get up and move. We thought that we should encourage them to rest and preserve their energy while going through treatment, and then pick up a healthy lifestyle after. There's been a lot of exercise oncology research done in the last 10 years that has proven otherwise, actually. So, and this makes sense because let's look at cancer treatment side effects and proven exercise benefits next to each other. When you're going through treatment, a lot of common side effects can be fatigue, nausea and vomiting, metabolic disorders, depression, anxiety, weakness, alterations in your bone and muscle mass, and something called chemo brain that we refer to. Now we look at proven exercise benefits. We know that exercise can increase your energy level. There's been studies in the cancer population, actually some of the first studies in the 80s, that have shown that it can reduce nausea. It can increase your insulin sensitivity, so that counteracts that metabolic disorder side effect. It can provide mood stabilization, so it can increase your anxiety and depression. Reduction in stress is the next one. It can increase your self-esteem, improve your upper and lower body strength, improve your balance, improve cognition, so that refers to that chemo brain, and improve your overall quality of life. The proven exercise benefits that have asterisks next to it are ones that have strong evidence within cancer exercise research that it allows that to happen. That's a proven benefit of exercise specifically within the cancer population. The other ones that don't have the asterisk maybe have moderate to low evidence, or they're proven just overall in the general population. What else? So if you can have improved energy level, physical functioning, decreased anxiety, depression, possibly decreased nausea, then this is going to improve treatment toleration. So you're going to be able to get through treatment better and hopefully on time. So if an improved treatment toleration is the effect of incorporating exercise into your cancer care continuum, then you're also going to have improved treatment completion rates. So that makes you happy because we want to get through this as best as we can and is feeling as good as we can. And it makes your care team happy because they don't have to delay your treatment for any reason. So it really is good for everyone involved. And then let's look moving forward. So say you had a cancer diagnosis, you were able to have remission for a number of years, or maybe you're just not doing a very healthy lifestyle and you're more at risk for developing cancer in general. Exercise has been shown to decrease or lower the risk of 13 different types of cancer. So it's proven very beneficial. And like I said earlier in the slides previously, obesity and overweight are characteristics that are bigger risk factors for kidney disease. So following an exercise program can help decrease your risk of reoccurrence or overall just getting a cancer diagnosis. Current recommendations for those living with cancer. So there was something called the American College of Sports Medicine Roundtable for Cancer Exercise. This was completed in 2010 and it was completed in 2018. The guidelines came out in 2019. And what they were looking at was all of the exercise research that has been done specifically in the cancer population. And what they have found in 2010 was that, yes, it was safe for patients to do that. And then in 2019, they found the proven benefits of the fatigue, the improved mood stabilization, improved physical functioning, and quality of life. They recommend, based on their overall literature review that was done on all that evidence-based practice, was that people with cancer work up to having 150 minutes of moderate intensity aerobic exercise or 75 minutes of more vigorous exercise, plus 2 strength training days per week with incorporation of flexibility. So warm up and stretching with each session. This does not mean that you need to do 150 minutes right off the bat if you have not been exercising. This is just a goal to work up to. There is another institution called the National Comprehensive Cancer Network, or the NCCN is something you may have seen it referred to as. And this network helps your physicians and your care team look at the evidence that's been done in regards to treating you for your cancer. So there's guidelines as to, okay, if you have this type of cancer, then this is what's recommended for treatment. So this institution also has added into their recommendations, specifically for cancer-related fatigue, that you should consider initiation and or encourage maintenance of physical activity or an exercise program to help combat those symptoms. They also added the resistance training part in for people who are on active treatment, and that's been a newer addition. So there are these 2 resources that have looked at the overall evidence and research that's been done, and they do recommend for patients or those living with cancer to start exercising to help their outcomes. So what about exercising specifically with kidney cancer? You should first and foremost always receive clearance from your doctor, especially if you have any reasoning that confirmation of bone metastasis, or if there's any concern for it. You should definitely get clearance from your doctor as well as your surgeon after any procedure that you've had done, because they may have specific guidelines that they want you to follow before you start being more active. It's also very important to do a slow and steady progression. This is training you to make a lifestyle change if you have not previously been active, or if you were active and you haven't for months or a couple years and you're getting back to it. Slow and steady progression is very important. You may not be at that same level you were before diagnosis. So when somebody gets diagnosed, there's a lot going on that you have to combat and coordinate and things like that, and you may go to surgery and everything happens in a blink of an eye, but it's been a couple months before you can actually open your eyes and understand, you know, where you're at in that moment. So it's very important that you understand that you may not be at that same level you were before diagnosis, and that's okay, because whatever you do then moving forward is going to help benefit you. Incorporating weight-bearing exercises for your bone health. One of the functions of your kidneys is to aid in vitamin D metabolism. And vitamin D helps to manage absorption and maintenance of the calcium levels in your bone and your blood. So it helps do that maintenance with calcium, and we know that helps your bones get strong. So if there's any influence on how this metabolism is working based on your diagnosis, then you should consider doing weight-bearing exercises. There are low-intensity weight-bearing exercises that can be done. If you're working with an exercise professional, you should ask them and make sure you let them know if your vitamin D levels have been low or you're taking a vitamin D supplement, because this is important to incorporate into your program. Hemodialysis considerations. One thing that is recommended is to exercise on your days off. Hemodialysis days can be very long, and they can also alter your blood pressure. So exercising after you had hemodialysis that day is not such a great idea because you can be feeling more dizzy or lightheaded, or your body's adjusting to those volume changes, and you don't want to put yourself at risk for injury. So coordinating your exercises on your days off is important. Also, if you're on any type of fluid restriction, talking with your doctor, your nephrologist about hydration if you want to be active, is also something important to do. There have been studies done that looked at exercising more so doing some cycling during hemodialysis and some stretching exercises. And they have been shown to reduce anxiety and depression and restless leg syndrome in the hemodialysis population. So if that is something that you are going through, it can be beneficial for you to ask your doctor if it's okay to do certain stretching exercises, or some institutions also have some pedals. There are devices that you put on the floor and you can pedal while you're going through hemodialysis. That's also an alternative that you can use. If you have an AV fistula, the studies that have been done looking at AV fistulas in relation to strength training really have been done to look at the maturation and how well it's working. And they've used low weights, so 6 pounds or less, that show that it does help with the AV fistula formation, and it's working for dialysis. If you are wanting to lift heavier than 6 pounds, you should always get clearance from your nephrologist to make sure that that is okay and err on the side of caution. It most likely will be okay, but it's important that you get that clearance first. What about if you're on active chemotherapy or immunotherapy, targeted therapy treatment? Let's look at the side effects. So when somebody starts treatment, they're more at risk for losing their muscle mass or having some deconditioning happen. Exercise can help with you regaining that muscle mass by doing some strength and resistance training. And what's even more cool is that the way that treatment can be is metabolized in your body can depend on your muscle mass. So it's been shown that patients who have a higher muscle mass or lean body mass can tolerate treatment better, the way that the chemotherapy and other treatments are metabolized throughout your system. If you are at risk for lymphedema, so if you had any type of metastatic disease to lymph nodes around the lower area or near your kidney cancer, it is safe for you to exercise. We used to think that it was not if you were at risk for lymphedema, but it has been proven that it is beneficial and it is safe to do, but you do need to, as we've said this before I've said this before a couple times in the presentation, you need to take a slow and steady progression so that you do not aggravate or put yourself more at risk for developing lymphedema. It is also important to incorporate some specific warm-up exercises, which will be on the next slide, before you do your exercise program for the day. Sometimes treatments can cause gait imbalances. It's important that you incorporate balance exercises into your program then. Surgical site consideration. You have to definitely make sure that there is proper healing at wherever the surgical site is, and that you get clearance from your surgeon to continue to be active or to continue to lift a specific weight. Your blood count levels. If you're on chemotherapy, you have to be mindful of your risk for bleeding or for infection. If you are more at risk for bleeding during a certain part or day or week in your cycle, then we would not want you to be using any free weights, because if you drop one or something like that on yourself, you run the risk, if you're more at risk for bleeding, you'll be bleeding, you'll bruise a lot, so we do not want that to happen. If you are more at risk for infection, we would be more mindful of you going to a gym to work out. I know right now during COVID, everyone is more mindful about that. But specifically with the cancer population, if you are at risk for infection, you have to be more mindful about how you're being active during the day or for your exercise program. Cancer-related fatigue. Sometimes patients are very fatigued the day one that they get treatment and following 5 days after. Some patients are more fatigued near week 2 in their treatment. So everybody is a little bit different. In relation to exercise, you would want to save your harder days for the days that you feel the best, and even the time in the day that you feel the best, and do more of an active recovery, like just a walk around the neighborhood or some easy flow yoga or stretching exercises when you're feeling more tired. So if you feel very tired the first couple days of your treatment, just go for a 5-minute walk a couple times throughout the day if you can. Do a 5-minute walk just daily if you can. Don't try to push yourself or plan to push yourself to do a full exercise workout that may be more strenuous than you're used to on the days that you're feeling really tired. And you can keep track of this in a calendar so that you know when you're feeling more tired, so you can plan accordingly. Nausea and vomiting or diarrhea, those can be side effects from treatment. The rule of thumb is to wait 24 to 48 hours, usually somewhere in between there at about 36 hours, until those symptoms are resolved. If you are dehydrated because you've been vomiting or having diarrhea, we don't want you to be pushing yourself hard with a workout. We want you to focus on making sure you're staying hydrated and waiting for those symptoms to resolve and then to work out. The lymphatic drainage warm-up exercises. If you are at risk for lymphedema, if you're working with an exercise professional, you should always tell them that you are at risk for lymphedema so that they can plan your program accordingly. To help decrease your risk of lymphedema from getting worse or even from happening, you want to make sure you start with a gentle 2 to 5 minute cardio warm-up. This can be on a bike, it can be just walking outside leisurely, it can be on the treadmill, and then do upper extremity lymph drainage warm-up series, followed by a lower extremity lymph drainage warm-up series. If you want more information on lymphedema warm-up exercises to do, reach out to Scott or Judy, or Linda, I'm sorry, with the Judy Nicholson Foundation, and let them know, and I can provide that resource to you. COVID-19 exercise considerations. Everyone is being more safe, and that's very good. We should continue to do that. A lot of these things you may have been used to doing already because of your diagnosis of cancer and being on treatment and being more at risk for infection. But following these precautions will be helpful for you. So during exercise, definitely if you're around people and you're not able to maintain that 6-foot distance length from them, you need to be wearing a face covering mask, having 2 with you if you're going out for a run or something like that where you're afraid it's going to kind of get soiled. If you're sweating, then you bring an extra one with you. Bring a sanitizer with you when you're going out and working out. Know that that mask is going to inhibit you from breathing as you would normally. So an exercise that wasn't taxing to you pre-COVID days may be a little bit more taxing earlier than expected if you're wearing a mask. Avoid touching your face when you're exercising, and then always try to wash your hands before and after you go out somewhere. Remove your mask correctly. And definitely do not exercise if you are neutropenic and you are more at risk for infection during your chemo cycle and you're having any fevers or anything like that. You should not be exercising. You should be calling your doctor. Continuing on with exercise considerations, be mindful of your blood counts, your body, and your surroundings. Make sure you're practicing good hand hygiene and sanitation. There are a lot of home workouts that you can do, a lot of cancer wellness houses that are non-for-profits. I know the ones that are in Chicago. I'm sure there's one close to you. A lot of them are doing virtual training sessions or virtual classes. So you can definitely have that resource for you at home if you are not able to go to the gym because of your blood count levels. Right now, take advantage of going outside if it's still nice out where you are. In Chicago, it's still pretty nice out, so take advantage of going outside. Obviously, that's not a ventilation issue if you're working out outside, whereas working in a gym or an enclosed setting would be more of a ventilation concern. Wear a mask when necessary. Using your own equipment. If you are going to a class, recommended to bring your own mat. If you have resistance bands or free weights, recommended to use those. Or if you're not able to, you always want to ensure everything is being cleaned before and after, even if you have to do it yourself, to make sure that that lessens your risk of getting any type of infection. Wearing workout gloves, these are not like the gloves that we wear as nurses within the hospital setting or your doctors. There's actual workout gloves that can help with your grip on things. So wearing workout gloves is also another consideration that you can do while you're exercising. Staying active, maybe committing to an exercise program. Maybe it's not where you are at right now. That's okay. Just being more active during the day can help. Maybe you get to wanting to be in an exercise program or work on other things, but just being more physically active and limiting your time sitting is going to be beneficial for you. So some activities of daily living that you do that you're active and you're using a lot of your muscles to complete is something such as mowing the lawn and gardening, cleaning the house, leisurely riding your bike, taking the stairs instead of the elevator, or parking, down the way at the grocery store and walking, those types of things. Most important, just to limit your time sitting. If you can walk or bike somewhere instead of driving, great, do that. Limit your TV time, or if there's a show you just have to watch and you don't want to miss it, try, if there's a treadmill in your house, try walking. If you don't have a treadmill in your house, you can just march a little bit in your living room while you're watching the show. Taking breaks during the workday to get up and stretch is important, and also just getting up and moving possibly on your lunch break, or taking 15 minutes every couple of hours to do a lap around the office. If your office is in your home right now because of COVID and you're working from home, doing laps around your kitchen or down your hallway or around your house outside if the weather's nice can also be helpful. Resources. Ask your doctor about getting active. If your doctor thinks that you would benefit from some physical therapy first, he can give you the referral to that so that they can properly assess you and make treatment recommendations and follow you to make sure you're strong enough to then do some exercise programming on your own. Free group classes. There are free group classes through a lot of community wellness centers for cancer patients. The one in Chicago that I'm aware of is Gilda's Club. I believe they're in different states as well. There's also Cancer Wellness House and just the Wellness House. So there are multiple resources that should be available where you are. I would just Google cancer wellness center near me and see what comes up. There's also one-on-one personal training sessions that you can, or personal trainers that you can look for. There is a specific certification to work with cancer patients, which is really great because that makes you feel maybe a little bit more comfortable with the personal trainer that you choose. And there are ways for you to find a personal trainer that specializes in cancer. You can go to the ACSM, so that's the American College of Sports Medicine Pro Finder, as well as the ACE Fitness Pro Finder. And then to make it simpler to remember, the Cancer Exercise Specialist Directory can also give you a list of cancer exercise specialists near you. You would just put in your zip code and they should come up to see if there's anyone more local. Anyways, exercise has been known to cause health and happiness, so it's never too late to get up and start moving to improve your health. Okay, so I am going to set up here. If you guys were interested in sticking around, I am just going to do 5 functional movements and see if that can help you understand the 5 functional movements that we talked about in the beginning of the session and how it can help benefit your muscular strength throughout your day while you're doing activities of daily living.
Awesome. Before we jump into that, would you mind answering a couple of questions from the audience?
Oh, yes, definitely, yes.
We had a couple of questions come through, and if anybody else has questions, please feel free to type them into the chat box. But the first question we had was from Ken, and he's asking, how can we jumpstart things? I'm an Iron Man who got kidney cancer. I did immunotherapy, but had terrible side effects, including diabetes, and I find it hard to get moving. So what's a good way to jumpstart that?
Okay. All right, so I think what's most important is figure out what time in the, which you sound like you're pretty well versed in training. So figuring out what time in the day or week you feel best to start getting active. And then I don't know if this is what you are struggling with. It's when you're used to being that active, you may push yourself too fast too soon. And that may discourage you from getting moving because you may get, really sore one day because you pushed yourself too much. When you're dealing with cancer and you're trying to get a good cancer exercise program going, it's important that you start slow. So you may be starting, just by doing 5 to 10 minutes of walking a couple times a day for a couple weeks and then improving moving forward. If you go too quickly, you may discourage yourself. So I don't know if that's the concern you're having or if just in general you find it hard to just get moving. Music helps me, so I don't know if that could helps you with your motivation. Sometimes exercising with friends or family can help you get motivated to move, or even joining one of those cancer wellness communities where people are struggling with the same concerns that you may be having, and building that rapport socially can help you with the motivation to get moving too.
Thank you, Jenny. And then we had another question from J and M, and they ask, how does low platelet count, low hemoglobin, and low red blood cells affect your ability to exercise?
That's a good question. So the low hemoglobin and low blood cells specifically affecting your ability to exercise, you may feel more tired. Hemoglobin works to bring oxygen throughout your body and help, with functioning. So if your hemoglobin's low and your red blood cells are low, so there's less circulating oxygen throughout your body, a common side effect or symptom that you can have is to just have more lower energy, or even be more at risk to feel more short of breath, more easily. So that's how it can affect your ability to physically exercise, okay? For platelet counts, it's not so much that it affects your ability to exercise, it's more that it's more of a concern about your safety. So if your platelet count is low, then you're more at risk for bleeding and bruising. So because of that, you need to be more mindful about what exercises you are doing. If you're more at risk for bleeding or bruising, you're not going to be wanting to, you know, mountain bike around your mountain bike trails by your house, or be using free weights that are maybe increasing your weight that day and going full force. Because if you drop those, then you can injure yourself. You can bleed a lot, you can bruise a lot, and we don't want that to happen. I hope that answers your question.
Yeah, that's great. And then a new question from Tony. He's saying, "Hi Jenny, thank you for this wonderful information. I've read that using a rebounder or a small trampoline is beneficial for cancer patients because it stimulates lymph circulation and drainage. I like this idea because it's fun, low impact, and a powerful workout that can be done in a place and takes up little space. I'm very interested in learning more about how a healthy functioning lymphatic system can contribute to a better functioning immune system, which can benefit cancer patients. Can you provide any insight on this and perhaps suggest best exercises for stimulating lymphatic drainage? Thank you."
Yeah. Yes, definitely. I have not read any evidence-based articles on using the small trampoline and rebounder, but I will look into that now that you bring that up. The main thing that's important, yeah, it does sound really fun. I'd love to jump on a trampoline too, and it is more low impact. I wouldn't urge you to do that right away because I don't know the evidence behind that theory. I will definitely be looking that up later. What we do know though is the lymphatic drainage series that we can go over that too. I can do it with you after. Has been proven to help limit your risk for developing lymphedema after having lymph nodes removed or even having radiation where your lymph nodes are, anything that's damaging to the lymph node and lymphatic system. So we can go over that series together. And really it's, well, we'll go over it. We can go over it together so I can explain while we're doing it.
Okay, that seems to be all our questions for now. Why don't we get into the practice exercises, and if any other questions come in, we could go after those afterwards. Okay,
that sounds great. I just want to make sure I don't close out of here. I'm closing down the chat.
Yep, what you want to do is click the little arrow next to the share screen button. Actually, let me do it. I can stop the share, I believe. Share. There we go.
Perfect. Okay, great. So sorry about the background. You're totally fine. You have to work. I am, like I said, I'm traveling right now, so I'm in the exercise room at the hotel that I'm staying at. I'm by myself in here, and they're just doing a little maintenance behind me. So I'm going to come to my mat. And what we're going to do is, if you are at risk for lower body lymphedema, so your lower extremities, your legs, because of lymph node removal from your waist down or abdomen down, or radiation around that area, it's important that you do 2 lymphatic drainage exercises. So in relation to any exercise program you're going to do that day, you would want to warm up just a low intensity 2 to 5 minute cardio warm up on a bike, walking, whatever cardio warm up you like to do. And then you would do these lymph drainage series. So we would start with breathing. What a lot of people don't realize is you have this vessel, your lymphatic system is made up of vessels, valves, nodes, and it circulates that fluid throughout your body. Your vascular system, so that's your blood, has your heart, which actually works to pump the fluid efficiently throughout your body. Your lymphatic system doesn't necessarily have a pump, and it relies on those vessels and valves, and your skeletal muscle contraction can also help aid in lymphatic drainage. So now that we talked about that, one of your main vessels is your thoracic duct, and that's sitting kind of right here. This helps to drain 75% of the lymphatic fluid in your body. So everything but your your right upper quadrant, it's responsible for draining. So the way that we start our lymphatic drainage series for your warm-up before you actually do your exercise is with breathing exercises, because it helps stimulate that vessel to start stimulating that lymph movement, that lymph fluid movement. So you'll put one hand on your belly, one hand on your chest, and you're gonna breathe in so much so that you feel your belly expand. And then breathe out. So you breathe in, and then you breathe out. For the sake of time, I'm going to do each exercise twice. You would want to do it 5 to 8 times in a row before you move on to the next one. The second exercise that you do is something called a pelvic tilt. So you would come down to your mat or the floor, and what you notice is a pelvic tilt. So your hip is here, and what you want to do is bring your hip back so that the small of your back is going towards your mat. Good. And then we do that again. Good. And you'll do that 5 to 8 times. Then we come to a modified sit-up. So you're just lifting your shoulder blades off the ground and going back down. Lifting your shoulder blades and going back down. If you're not able to do a sit-up, you can also use a medicine ball or a yoga ball and put that on your lap, put your arms on top of it and push down. The main thing that you want to do is engage those core muscles. Okay. And then we're coming up. So why we do our abdomen first and these muscles is to centrally start that lymphatic flow, and then we work our way out to our extremities. Because you'd be at risk for lower body lymphedema, you have to do the upper body lymphedema, lymph drainage series first before you move to the lower. So the upper body is you're going to come up, and you will do some shoulder shrug, you're going to do some neck stretches. So you're going to bring your left ear down to your shoulder, stretch, and come back. And again, stretch, good, stretch, good, stretch, good, good. And then you're going to bring your arms up like this. You're going to squeeze your shoulder blades, squeeze, squeeze, good. Then you'll come to do a chest press. It's called an isometric chest press. So you're going to put your palms together and push them into each other. And what this specific exercise is doing, it's activating these muscles here that's going to help with lymph drainage flow. Good. Then you're going to do some shoulder shrugs. So you'll come up and down. Good. And then some shoulder rolls. Good. And then either you bring your arms forward or up. We would prefer that your arms are up. Sorry, I'm getting cut off here. So I'm going to put them here, actually. And you're going to do some flexion and extension of your wrists. Then you go into some wrist circles. And then fist clenches. And like I said, if you're interested in getting information on this series, you can just let Scott know and I can get those to you. So that would be for your upper body series. Now you're going to come down to do your lower body series because you are at risk for lower extremity lymphedema. And you're going to bring your legs up. Your knees should be right about above your hips, 90-degree angle. And you're going to do some bicycles. Good. Good. Then you'll come back to that 90-degree angle, and you're going to do some flex and extensions. Good. Good. My feet are cut off, so I'm going to put them here, and you're going to do flexions and extensions of your toes, but with your legs up like that. And then you're going to do circles. All right. So that would be your exercise that you should do before you actually do your exercise program of that day, because it helps with the lymphatic flow in your body so that it puts you less at risk for developing lymphedema. I'm kind of reading the chat that's coming through. Denise, Scott put my page on there. Please feel free to reach out there. I can also give you my email address. If Scott, you're okay with it, I can type that in here to everybody for them to use. And then I lost almost a message.
Absolutely. Yes, we'd love for you to be able to contact him. So if you'd like to share your email address, please go ahead. We also had an additional question from Michael Freed. He said that I had lost all muscle mass and 10 pounds while he was on oral therapies. And is there a suggestion on how to gain back muscle mass in a healthy manner?
Yes. So thank you for that question, Michael. The main thing that you want to do first is either you ask your doctor if you need to see PT or not, or if you see an exercise professional on your own. What they're going to want to do is look at your range of motion and see how it is first, so that it's always rule of thumb that we want to straighten and have a good posture before we strengthen. So if there's any muscle imbalances, they can work on that. And then once that's worked on, either if you have to stretch your chest muscles more or strengthen your shoulders, then they can start to work on a resistance training program. And what they'll do is they'll go slow with your progression, and that should help you gain muscle mass healthy. So you're not doing too much too fast. But the most important thing is to make sure where you're at now, you don't have any muscle imbalances that would have to be worked on before you actually add weight to your program.
All right. Well, I think we all learned a lot today. Thank you so much for joining us,
Good.
Jenny. The information you shared today is always a topic that everybody brings up on a variety of our other conversations. And so I think that you covered a lot of great topics for us today. If anyone would like to get a hold of us, we put the contact information in the chat box. You can also, I have it pulled up on the screen here, that you can find the Fight for Fatigue Facebook page by going to facebook.com/fightthefatiguefitness. And of course, you can also go to the Judy Nicholson kidney cancer page. You'll find that we have an upcoming kidney cancer conversation on the role of mindfulness and coping with anxiety. So that's coming up on October 28th. If anyone would like to join us for that, you can just click on the link on our homepage and register. This will also be at 1:30 p.m. Eastern Standard Time. So if anyone would like to join us, we'd love to have you. And if you do end up, if you missed any part of this conversation, it will be on our Facebook page, and you can find it on the video section of our website as well. You'll find a library of all the past videos that we've had with doctors and caregivers and survivors, and there's a whole bunch of great conversations that you'll find on this page as well. So if there aren't any more questions, we'll let you go for now, Jenny. But thanks again. And thank you everyone else for joining us. Have a great day.
Thank you, you too.